Everybody, and thanks so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about improving your skin after a long, hot, sweaty summer with a Hydrafacial. It's available at Bridges to Beauty, and Dr. McIntyre Bridges himself is joining us today to talk to us about it. He'll be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. If you're watching online at KTBS.com, just submit a question there on the right side of your screen. We'll see it and we'll pose it to the doctor, or you can just give us a call. The number is 318-219-4569. It'll remain there at the bottom of your screen, and we will be taking your questions until 12:30. Thanks so much for being here, Dr. Bridges.
No, my pleasure.
Okay, so what is a Hydrafacial? People probably know the general idea of a facial. A lot of women probably get them at a salon, but what is different about this Hydrafacial specifically?
Well, Hydrafacials, you can only get them in medical offices, number one, because it's actually a medical program or technique. But what it does is it has 4 different solutions that it uses to clean the face, cause deep extraction of the pores, as well as to put in antioxidant, which stops the oxidation process that goes on in the skin constantly, as well as hydrate the skin with hyaluronic acid. I mean, you need those 4 steps to kind of get your skin in the best health it can. And after the summer, it's taken out, despite the fact you might have put it on sunblocks, etc., it still takes a toll.
And you were kind enough to let me try this firsthand yesterday so that I could kind of tell people what it feels like and the difference that I've seen. We have some video from this. Like you said, there's a couple different steps. There's that machine that you see right there, and then with the little tools, you kind of goes over your face, and I don't know, it feels like it's about the size of like a dime, maybe, moving across your face. And yeah, you see it right there. It doesn't hurt at all. It kind of feels like a sponge, just like a wet sponge kind of moving across your face, and there is a sucking motion there. You can hear it. It is a little bit harsher than a sponge, I will say, but not, harsh by any means, just a little abrasive. And you have those 4 different steps there, and your face gets a little wet, and it's actually kind of relaxing.
Yeah, a little wet.
A little wet, yeah. There you see me getting mine there yesterday. Okay, so this is not an operation. This is not invasive at all, right?
That's correct. Yeah. It's just, like I say, it's very good at cleansing off all the 5 layers of dead skin, which is a little bit difficult with the microdermabrasions. To be able to clean out the deep pores, you have to soften the sebum and debris that's in there. So the acid peel is the second step. And the third step really is using what is called a vortex vacuum, which I guess if you had to liken it to something, it'd be a Dyson cleaner. It's not that hard, but it's the vortex which actually swirls around and cleans out the pores very good without having to press on pores and cause some inflammation associated with that. The third thing it does is when you get through with all that, you haven't really beat up on the skin, but it needs some nutrients. Our skin is always under attack from pollution, sun, etc. It needs antioxidants. By infusing the antioxidants, vitamin C, glutathione, other important antioxidants, it really does stop that oxidation process, which breaks down collagen, which makes skin more like leather than it is elastic. Also, the induction and penetration of hyaluronic acid, which is really the natural moisturizer that's embedded in the dermis being more sponge-like. If you put the hyaluronic acid back, that's what holds water into your skin.
So you're kind of, I'm sure different things like this can put things in your face that are good, and then other procedures maybe take things out that are bad, but this really does both, right?
Yes. I mean, it cleanses, extracts, and hydrates and nourishes.
There was the last step after, you kind of used the things on my face. The very last thing that you did was put what felt like a lotion on my face.
Yes.
What was that part exactly?
Well, that was another lotion that has nutrients in it, and especially hyaluronic acid. You have a particular window after you do this, after you've taken off all that dead skin, to actually get better penetration of larger molecules like hyaluronic acid and vitamin C's past that superficial barrier of the skin. The skin is very good at protecting us from the outside world, and so once you take off those dead layers, that dead layer is part of your protection, but once you take off the dead layers, you can get that penetration and just get a better infusion. If you use products afterwards, like your vitamin C serums, your retin-A, they will absorb better also, and they're very, very good for the skin too.
People hear acid, or at least I hear acid, and I think harsh, damaging, but you were explaining to me that's not always the case. There are some acids, like the ones that you use in this procedure, that are very good for the skin and not really harsh at all.
Right. When you say acids, I guess most people think of the hydrochloric acid on the movies where they or sulfuric acid, they pitch it on somebody. Now, you remember there's strong acids and there's very weak acids. Hyaluronic acid is a very weak acid, but since it's an acid, it has difficulty passing through the oil barrier or lipid barrier of the skin. And so you really want to remove that, so this weaker acid that is beneficial to your skin and used to be part of your skin can enter again and hydrate the leather or the dermal portion of your skin.
Why is this a machine that you wanted to have at your practice?
Mainly for skin health and rejuvenation. You can do all sorts of other things like the microdermabrasion. It's good. It just isn't complete. It tends to be a little irritating and drying. Some people get irritated so much that they get a little acne from it. But this is gentle. It cleanses off even deeper layers of dead skin. The ability to get down into pores without having to manually compress skin, which would cause irritation and even bigger problems. And then to hydrate it, I think that's a good package.
Yeah, and it is something that is relatively new at your practice. How long ago did you get the machine?
Really, a couple of months ago. We've had it for a while, but we've upgraded to this, and this is much better.
Yeah. How does this compare? You talked a little bit about microdermabrasion, but really, how is this specifically different from that?
Well, microdermabrasion, again, there's really two methods to do it. The original one was it's almost like having a sandblaster. And basically, it would blast the skin with sand, and then you had a little suction that would kind of take it away. It was supposed to knock off all the little dead cells, or as much as it could, without causing any real abrasions, which it can. And so the other one is using what's called a diamond microdermabrasion. We actually have one in the office that we'll use depending upon how I guess plastic-like the skin is before we use the Hydrafacial. The problem with the ones with the sand was getting people's eyes, getting people's ears, be kind of gritty, hard to wipe off. You don't have that with the Hydrafacial. I mean, it's a gentle hydration of the tissues, allows it to come off. The little we went through 3 different nozzle types, when we do this, and one's for exfoliation, one's for penetration of the acid, so that basically, all that debris, all that sebum and sweat and, other stuff down in the pore can be loosened up. The vacuum portion of it, there's specific fluid for that gets out for deep extraction, and then of course the hydration. So that's the biggest difference between the two. I mean, it does really the first step better than a microdermabrasion, but then it has other 3 steps that really complete the process.
And if people are thinking about possibly, getting this or getting a facial at a regular salon, what is this going to do that a facial in a salon won't do for people?
Well, I think doing facials they're very good. I mean, they help moisturize. I think if you got pore problems, the mechanical use of the little tools and things like that. I mean, I find that it'd be a little bit inflammatory, and you walk out with kind of red areas, versus with this, it's just gently cleaned out. I mean, the acids in this are powerful enough to break up all those blackheads, whiteheads, much easier than I think a regular facial.
Now, we talked about how this cleanses the skin, and it's great for that. But is this something that's going to help wrinkles if somebody's looking for that?
It does. I mean, you hydrate the skin and the fine lines start to disappear. It's very good for fine lines, helps with deeper wrinkles, hyperpigmentation, which are basically those age spots we get over time, because part of that is cleaning off all those deep layers, and then also giving the antioxidants to the skin, because the antioxidants keep inflammation down. If you keep inflammation down, then you have less age spots.
And I'd imagine it would at least have to help some people with acne too, if it's cleaning the skin so well.
Oh yeah, it's excellent for that. Part of that acid has a little salicylic acid in it, as well as glycolic acid, and so it's typically with acne they'll use the salicylic acid because again it breaks down all that debris that's normally in pores that cause acne.
Who is the best candidate for a Hydrafacial?
Well, really anybody over 20. And even before, like we've had people who are getting married. They come in, they want to look fresh for that special day, and by the hydration of that skin and cleansing it, certainly makes their day even better.
How long does this take? Is this something you need to block off like half of a day for? I know the answer to that because I had one, but it really only takes. It took 30 minutes or less, I think. Mm-hmm. Really,
yeah. Anywhere between 20 and 30 minutes is typical for it. There's some add-on things that you can put, which like the Derma Builder. That'll take about another 5 to 7 minutes.
Let's talk a little bit about that, because that was one of my other questions. Are there other procedures that you pair with this if people want to get, the whole day, take a spa day at the office? What do people normally get done with this, or what do you recommend that could be good?
Well, with this, you can actually do some injectables. People come in for get this, they'll get their injectables. I'll do actually the Hydrafacial first, and then I'll do the injectables instead of having to. This isn't much pressure I put on the skin, and so I don't think the injectables would be, changed in any fashion. But I think that doing it after is much better. It delineates things easier for me.
And this is something, there are some procedures where, you may get them like a peel, I would imagine. You're not going to want to go back to work after that, or maybe some other harsher procedures. But this is really something that you could get done on your lunch break and go back to work, right?
That's correct. I mean, for the typical lunchtime peel was the glycolic acid peels, and they tended to make people a little bit on the red side. Some couldn't cover it up, depending upon the sensitivity of the skin. Whereas this hasn't been a problem. They'll put that makeup on, going about the business. People with real sensitive skin, the differences you make is the amount of suction that you place on the vortex, and so that they don't get irritated. And that's why I asked you yesterday, does this feel okay? Is this hurting? Is this suctioning too much? Because from one person to another person, you have to kind of evaluate those.
No, I thought the pressure was just fine. And I know it does feel a little different when you get to those sensitive areas like you did do around my eyes, but you turned down the suction for that, and it felt just fine. It wasn't too much, and you were very attentive about asking me about it, so that was nice. Do you get better results with more treatments from this, and how often can you get this done?
Well, more treatments are good. We'll next week or Monday we'll start a special on it, where you get 5 treatments and the 6th one's free. Generally, it'll be every 2 weeks for the first 4, and then every month, until that 6 is completed.
What kind of difference can people really expect to see in their face? I mean, I know after one treatment, I saw brighter, softer. It even seems like my pores are smaller. That's what I saw after one visit. What can people expect after, going for several times, over 6 months? Right.
Well, I've seen even after one treatment, besides the features you had mentioned, actually a decrease in the age spots. I mean, in terms of the actual being able to see them. But getting off that dead skin and cleaning up those pores, because a lot of age spots will have excess oil in that region. My wife had it, and it was a big difference before and after.
Are there any tips that you have for afterward, after you get this done? Is there a sensitivity to the sun? Should people watch out for that? And also, what about a little extra dryness? Does that ever happen?
Well, the dryness generally isn't a problem, but I think in all cases avoiding the sun is not a bad idea. This is not as critical as it would be if you did a deep chemical peel or a Vi peel, which I like the Vi peel too. Again, the hydration is probably one of the keys. So the dryness isn't that big of an issue.
Yeah, it is called a Hydrafacial, so you would imagine that it is very moisturizing and not as drying.
Right. I think it's important to be on a good skin regimen too. Okay? I always tell people if I'm on a desert island, there's 3 things I can bring as far as skin. It would be a vitamin C serum, maybe a little bit of retinol, and of course a sunblock of 50 plus.
It's always better to do things ahead of time. It's better to wear sunblock every day than treat age spots and wrinkles later.
Yeah, the biggest hit to our skin, period, is not particularly age as it is sun exposure. It's kind of like I always tell people, it's kind of like if you got a sheet of plastic and you put it out in the sun, in 3 months it would be brittle and it would fall apart. And the collagen in our skin is really similar. And our bodies can't clear out those little pieces of plastic that basically are formed when that breaks down. I mean, it's not as good. You have to have some stimulation for it, and the Hydrafacial is good for that too.
Why is this a good time of year to consider this? I know that I feel like I suffer more breakouts in the summer. I have to wear so much makeup to do this job. I feel like I have to wear clown makeup sometimes. It's just kind of piled on there. And I feel like in the summer, it almost, that causes more breakouts because you're sweating more, there's just more gunk on your face, plus you got the sun damage. So is that why you think this is a good time of year to be talking about this?
Right, and it's a good time of year for those reasons that you stated, but also if you're going to have, 5-star skin by the holidays, then you need to prepare for it. I mean, you've done real well during the summer times by keeping on your vitamin C serums and your retinol, retinol a little bit less because of the sun exposure, and your block, but it still takes a hit. You have to restore the moisture, have to restore those collagen fibers that have broken down due to the UV radiation if you're going to have great looking skin by the holidays.
I mean, that is very true. I mean, what are we, 5-6 months away from the holidays? Right. Maybe less than that even at this point, but you start thinking about things last minute a lot of times as far as like buying gifts and planning vacations, which it helps your life if you do those things ahead of time, so it'll help you to do this ahead of time as well. Yeah,
big changes in the skin have to be physiologic. In other words, the cells in the skin have to be woken up essentially to act like they did like when we were in our teens, and that after age 25, 30 is a problem because we have changes in hormones, certain stress in our life, we might be out in the sun a lot, and so all those cells get really dragged down and they don't function like they used to. They need hydration, they need moisture, they need nutrients, and they just need a kick in the butt, in order to get to the point where basically they're making fresh new collagen. They're breaking down old brittle collagen and refreshing the whole look. Pores don't get smaller overnight and things. They get smaller as time goes on, and 4 or 5 months and stuff is a reasonable amount of time to see the effectiveness of those treatments.
A kick in the butt. That's what the Hydrafacial will give you. So let's talk about some celebrities here. You wonder, what, those celebrities look so good. First of all, in the pictures, they're airbrushed, so that's a whole other issue. But I'm sure that in person, a lot of people say that they look great as well. And it's because they have the time and the money and the knowledge to choose the right treatments to do. And the Hydrafacial website, it says that there are several celebrities that use this and they all have great skin. A few of them are Adrienne Maloof, who you may know from The Real Housewives, Paris Hilton, who everybody knows, she has great skin, Marie Osmond, and Jillian Reynolds, who formerly went by Jillian Barbary. And you were telling me in the office while I was getting this done, this is something that celebrities will do weekly. They will.
They'll do it weekly, and like I said, they'll do. I recommend doing it weekly or every 2 weeks, so at least 4 or 5 and things. Then go to every month or every 2 weeks. I think that the rest of it would probably be a little bit of overkill, but and being some good products, of course, and they all are on good products, Retin-A's and the exfoliants.
That was going to be one of my other questions. Does this company have other products that you'd recommend, or do you recommend certain products of any kind used with this procedure?
This company has products, and I'll recommend them to certain people. I kind of go by skin type, okay, and what their history of how that skin is acted. Some of the products are better from other companies related to acne or to you're trying to reduce pores, and so I actually pick and choose depending upon the evaluation that we give. We have a skin evaluation or complexion analysis program called Visia. And you can go in there and it takes pictures of it, and then it does the UV pictures, and it tells you, it looks at all this bad stuff. When you see it, it looks pretty bad. But we generally start with one of those. Okay, do what we need to do in terms of the Hydrafacials, the products, and things, and then do a second one in about 3 months, because the skin turnover is a 3-month type of process, and you'll see a considerable difference between the two. I mean, that sun exposure really, what we see on the outside, things is much, much deeper than you would recall.
Talking about seeing a difference, when we were done, the machine kind of has a bottle on the outside of it that has all the solution that has been kind of run over your face and sucked over your face. It's clear when you start, or empty, or just looks normal. When you're done, you can really see a difference. It just looks like dirty
silt.
Yeah, silt. Like
floating on top.
You can see the dead skin floating on top, and it's all murky, and you just think, and I washed my face before I even got this done. It's not like you were taking off the makeup that was on there. That was all just what was either sitting on top of my face or in the pores. So what you can actually see what was taken off of your face when you're done.
Yeah, I was shocked the first time I saw it.
Yeah. I thought you were going to say you were shocked when you saw mine. I was like, really? Was it that bad?
Oh, no. Yeah. It wasn't that bad. I mean, yours, like I said, but you'll see it. I mean, it looks like just real cloudy water, and there's stuff floating on top.
That's one of those things that makes it really gratifying. I feel like when you can see the results right there, and how gross it all was. How much does this procedure cost?
It costs about $125. If you add on the dermal blender, it's another $35, I believe. And on the specials and stuff, we got it going for $125. I think it's more than that after it. But like I said, we have a pre-fall, get ready for the holiday special coming up and things. And it starts on the 18th, but you can go to the website on the 18th. If you're on our email addresses, then you'll get that earlier.
What is your website?
Yeah, it's bridgestobeauty.com.
Easy to remember. All right. Is this one of those procedures? Do you even call this a procedure necessarily, or is this? I know the technical name for it is a hydrofacial, but it's just a procedure? Is that
it's
correct?
A procedure.
Okay.
Yes, that's correct. And again, since it's able to infuse, it falls into more of a medical grade procedure.
Right. Do people with certain allergies need to watch out? There are people with really sensitive skin, I know, who have to be really careful about what they get done.
Not really. If you look at the ingredients, the molecules that are found in each of the solution, even the acid portion of it, is naturally found in your body. They just happen to be in higher concentrations. The things you watch out for are those people that do have sensitive skin. And it's not an issue of allergy as it is sensitivity.
And this is okay for anyone of any race or any age, you said? At least you like to do it older than 20, though?
I like to do it older than 20, but we've had some that have come in that for really acne, trying to clean things up. But it's for all skin types, so for all races.
That's great.
Yeah.
Now, could you do other body parts other than your face? I know you did do my neck a little bit, but what about, I know women, they should be, if they're not, are sometimes concerned about their hands, the back of their hands, or any other body part. Right. Has it been approved for that, or?
Yes, you can do other body parts. The back of hands is probably the second most common, even though it's not real common. For age spots and kind of the thinness that the skin gets. I mean, as you get older, it certainly gets thinner. And it helps restore that and clean up the colors primarily.
So people have used it for their hands.
Yes.
Okay, and also a lot of times men think facials are too frilly and girly, but you know, their faces need to look good too. They need to look good too going into the holidays. Is this something you have had any men at your practice for, or you know, do you think it'd be good for them?
Yeah, actually, I think men, if I had to put a number on it, represent 10%.
Oh, really?
Again, the nice thing about this is that you don't have to spend all morning at a spa unless you wanted to. And things. Men kind of want to get in and get out. You know, it takes, like, say, anywhere from 20 to 30 minutes. They like it because of that. You know, they're not going to put on makeup afterwards, and they really don't have to.
That makes a lot of sense. It is a great procedure if you want to get in and out and be able to go on with your day and not have anybody really know that you did anything.
Right.
So that's good for men. Why do our faces need so much extra attention? You know, that just seems to be the part of the body that has the most problems almost.
Well, it's because the two areas of the body that have the most sun exposure is your hands, arms, and face. Truly, you know, sun is the biggest enemy you have in terms of skin health. Pollutants, yeah, they add to it, so you need your antioxidants. It's just, like I say, it's more of an exposure issue.
Is there anything when it comes to the Hydrafacial that we didn't cover, or you want to make clear, or you want to make sure people know, or you really want to kind of hammer home here?
Well, number one is for all skin types, okay? And it is for men and women. You know, you're going to get the best, cleansing of the exfoliation of the face with Hydrafacial versus, a microdermabrasion. Having the ability to extract very deeply those pores that are clogged, or even if they aren't clogged, if they're going to have, cellular debris in there. I mean, you don't have to have blackheads to have cellular debris down in the pores. And then finally, the infusion of nutrients, antioxidant-rich nutrients and stuff, as well as, the biggest moisturizer in your skin is hyaluronic acid. You want to get it in there.
A lot of procedures, I know you have to come first for a consultation before you can really get the actual procedure. Is that something you need in this case, or can you just come and get it done?
Well, what we're going to do, beginning in on the 18th and going through the 5th of September, is if you come in, we'll actually do the Visia skin complexion analysis, which is about $150, thing for free. Okay, so I want to start off basically getting your evaluation to see what your true needs are. You can do the Hydrafacial. There's some other things we're going to do also, but it's not unreasonable to start with a baseline. Okay, do some Hydrafacials and maybe some other procedures, and then check that baseline 3 months later after you've had at least one skin cycle.
Tell us more about this Visia machine that you have. Why is that such a valuable tool? And why does it tell you, and how does it tell you things that you just can't see from looking at the face?
Yeah, you just have to see this. I mean, it's pretty incredible.
It's cool.
Yeah, what it will do is use, some visible light and then some UV light. The UV light will show you all the age spots and stuff that you truly have, that you do not see on the outside. The software actually diagrams where all the etches in the skin, like the minimal shadowings from pores, from wrinkles. Like I say, it's incredible what it points out. You might feel embarrassed about what it points out, but it really is. But it gives you a baseline. I mean, I think you can go and put on all these lotions, potions, goos, patches, do the procedures, and people really forget what they look like before or what they had before. So having a baseline is a good thing. It's helpful for them. It's helpful for us as far as guiding them in a direction with all the other procedures and stuff we might be able to use for them.
Well, this is one of the things on Healthline that I am able to talk about that I have had done firsthand, because you were kind enough to let me be able to experience, to tell people how it is. But I can tell you it did not take long, less than 30 minutes, not even really uncomfortable. Pretty relaxing in the end, and I really did see a difference in my face. And I need to wait probably a few days just to see how it how it comes out. But Dr.
okay,
Bridges,
Bruce.
thanks so much for being here.
pleasure.
Hydrafacial, very interesting. Some people should consider going into fall.